Welcome back to our chats at the campfire. And Dr. Ali, our amazing naturopath, is bringing us a plethora of information and helping us through this wonder of 40 plus and what our lives look like. Thanks, Ali, for bringing everything that you do to the campfire.
Thanks for having me back. And
Of course.
talk about sort of this next stage that kind of happens.
Yes. And to be clear, this is not happening without your expertise. So this is a dynamic duo of a girl living it and a girl's amazing brains and expertise and all that she brings to in her natural and scientific ways to this journey. You know, when today we're going to be talking about what is happening in the body, or the beginning of what is happening in the body at the age of 50 and 50 plus, really. And it was interesting as I was kind of putting this together to how I could, or how do I preempt what it is that I'm going through, as I think it is something like a third of the population is going through perimenopause, menopause, all the way through within this range of age and time at the present moment. So there is a lot of women who are going through the newness, and this is how I would like to explain it. In our 50s, we begin with a disrupted sleep, or I should say, this is just my journey, but you'll get the idea. We begin with a disrupted sleep, and then somehow these hot flushes come on. We don't know where they're coming, when they're coming, or how it's all going to hit us. And through that, there's this odd thing called body inflammation. And we don't know where that's going to hit us either. But it is all enough to create a rather agitated, frustrated, irritated, rageful woman, which then leads to an increase in our cortisol, which then leads to an increase in anxiety and anxiousness and lack of clarity and mind blurps, which then can lead to some heart palpitations and sweating and questioning what we're doing, how we're doing, who we are. And then God help us if we add a glass of wine or two to that, or a day of more sugar or junk food. As my one girlfriend stated it, she said, it feels like impending doom. And yet, Dr. Ali, I would like to share with you all of the women that I curiously asked them about, how are you doing it? There hasn't been one woman within my age range of 10 under and ish, 10 over, that has not said that we all feel that we are at a place of almost freedom compared to our mothers, our grandmothers, and our great grandmothers. And in that, it's not that any of these symptoms may have changed. Maybe they have, I don't know, but we are women and we experience this as a very natural process that's happening. However, the women that I speak to, we tend to feel very almost a level of empowerment, even though we feel disempowered in what is happening with our bodies and our minds and our skin and our hair and our energy. However, there are resources and there's support systems like yourself, Dr. Ali, that we can learn we feel empowered to make choices. We have choices and we're making decisions that are stepping us into a greater health. We are stepping into what I like to say a second spring. And it has possibility. It has curiosity to it. It has hope to it, even when we're in the trenches and sweating and not sleeping and feeling like we could tear heads off. There's something about this that maybe I don't speak for every other woman, but for myself, even in all of that struggle, I feel like I'm in a place of change, not just the change that's happening to me physically, mentally, spiritually, every component about me, but I feel like there's a change that's happening that perhaps my daughter and my great granddaughter and great great granddaughter will perhaps have a different experience because of conversations like this and learning and understanding and what we actually can do to aid ourselves. We do not have to grind through this, or as a physician recently told me, that I just need to tough it out. I don't agree with that. I do believe in discipline and toughening things out. However, I think life is tough enough. And to have support and information like you're going to offer us is, I think, where we're at today in 2024. And so, Dr. Ellie, as I say that, today there are many topics we are going to cover in this world, as our bodies are changing in our 40s and 50s. But today, Dr. Ellie and I, we had a previous discussion and we decided to cover the big E word, at least touch on it anyways, and get ourselves more informed and understanding what's going on. And that big word is estrogen.
Estrogen, yes. It's funny because I feel like there's this general idea that like estrogen is the big hormone in menopause, which is definitely true. But like we talked about in our previous chat, like perimenopause is more about like the progesterone and the cortisol, and estrogen is in there changing as well. But it doesn't tend to really take like such a big symptom, I guess, control until like, actually closer to menopause, right? And so that's where you're going to start seeing those lower estrogen symptoms happen. And again, recognizing that it's all interconnected. And I know we talked about that last time, like a hormonal symphony, but I think focusing in on sort of like the estrogen piece, and generally once you've hit menopause, which again is like no menses, no period for 12 consecutive months or longer, that's when you really start to get like the more noticeable low estrogen symptoms. So yeah, I feel like talking about it today in that sense, and that, yeah, it does play a big role. And in what symptoms does it play those roles, right? Helpful, and that there are things we can do to sort of support ourselves, like you said. And I agree, it's like we're in this time where there's more information coming out, or we're just, I guess, in a place where we have more information streams at our fingertips, right? And so I think like you and I have talked about how we just want to really get it out there, because yeah, I mean, I've definitely had conversations with women where it's like, I have so many of my friends going through this, but like a lot of them aren't doing anything about it because they have been told, it's just a part of living and aging as a woman. And I'm like, yes and no, right? Like, yes, menopause is a natural thing. And none of this is about stopping it, right? It's about optimizing our experience and our physiology and our mental health and our spiritual health and all of the change that comes through menopause and the changes. But I think looking at the physiology of estrogen is a big piece. So we can definitely kind of dive in on that.
Yeah. Just an aside to that, I think there's this piece in Ellie, with you being 15 years younger than me, I'm not sure if you've had the same experience, but when I speak to a lot of women who were born in the 70s and perhaps in the 60s as well, we were very much taught, giddy up, get your big girl pants on, get going. And there's also, if we choose not to, if we do less, it's shameful. The word lazy can come in, and that concept of rest and really nurturing ourselves was not something, certainly not something that I was accustomed to up into my 40s. And I think this is also another piece of this, Ali, when we look at information and understanding what estrogen is, and how it really is, even though it's happened to every woman, most women, should I say, in time, we can still make different choices, and we don't need to grind through this. We don't need to feel shamed because we are choosing to go different routes of caring for ourselves. They're all our personal choices, and understanding the health of them. So with that, what is estrogen?
Okay, so we've got, I think most women would know, estrogen and progesterone. We hear these terms, right? But estrogen really, its job, sort of when we're having a regular menstrual cycle still, is to work on building the uterine lining, right? So basically in the first half of the cycle, so day 1 to say day 14 or so of a cycle, estrogen is going to be working, and it's going to build the lining to get ready for potential conception and pregnancy. And then progesterone comes in and keeps the lining there. So it's a builder. Estrogen is a builder. That's what I like to sort of tell patients. Like, it's really about building and keeping things supple. It's also really, really important for lubrication. And so when I say that, I think people go in, directly to like vaginal dryness. And for sure, yeah, that's like a big piece of the puzzle, but lubrication everywhere, right? So joints. So like, you start seeing joint pains and things like this in menopause, because estrogen has been low for a while. So you're going to start seeing less lubrication in all areas. And again, so that's like, it lubricates our skin, it lubricates our joints. Yeah, it lubricates vaginal tissue. It helps to keep the vaginal tissue healthy. And so that can be like really important in terms of like women's libido and experience of orgasm and all of those things that can start to change. And then I have these questions, right? And I think there is sometimes, women don't want to talk about these things, but it is such an important part of our health. And I think a lot of times, like you said, like patients sometimes just hear, well, you just have to deal with it, or, use lubrication or whatever it is. But estrogen is important for all of those things. So it's a builder, it's a lubricator, it prepares the uterine lining for pregnancy in our cycling days. It also has an impact on thyroid and serotonin. So it helps to keep our thyroid healthy and balanced. And then it also kind of has this intricate balance with serotonin. And serotonin is a neurotransmitter. So this is a molecule that impacts brain health and mood. So again, thinking about estrogen as keeping our mood, feeling positive, feeling happy, feeling, just balanced from like a mood perspective. Estrogen does have a direct relationship with that. Estrogen actually has over 300 jobs in the body. So I can't tell you about all of them, but these are like some of the bigger ones that it is kind of contributing towards in our cycling years. And then it's also an anabolic hormone. So that just means it helps to build like muscle tissue as well. So generally you would find like women tend to do better, again, in the first half of a cycle. When it comes to physical activity, that's when you're going to do better with more high intensity workouts and weight training. Whereas leading up to the period, when estrogen is lower and progesterone is higher, you may be less likely to feel good doing those things. But when we think about that again, it's like, okay, so estrogen is going to help to build muscle tissue. And we had talked about how important muscle tissue is for healthy aging in general. So if we think about the changes that are going to start happening when estrogen becomes low, then it's going to impact that part as well. Another interesting piece, because I think a lot of women that I see are, sometimes alarmed about like the body composition changes that come along with, the longer they've been in menopause, like, they feel like 5-10 pounds has crept on, they can't shed any weight. Estrogen actually also helps to control our hunger. So as it decreases, not only now are you going to be in a less anabolic state for your muscle, but you're also going to probably have some changes in hunger cues and potentially have more hunger. So again, it's like this double whammy that happens, right? As that estrogen is on the decline or has been low for a while.
Maybe quadruple whammy, just saying.
Yeah, a big whammy.
A whammy. All right.
Yeah. So that's kind of estrogen in a nutshell. And like I said, it does a lot of other things. I mean, I should also maybe touch on the fact that when we talk about estrogen as a builder, it's also really important for maintaining cardiovascular heart health. It's a builder of bone in a sense, in that it kind of supports osteoblasts, which build bone. Okay. So this is where, I think most women know that as we age, we become more prone to bone loss, osteopenia, osteoporosis. But a big reason for that is that low estrogen. The longer you go with lower estrogen, the more likely you're going to have a hard time building that healthy bone, because there's less stimulation of those bone building tissue cells. And so if you couple that then also with, lack of physical activity, muscle loss, potential dietary or nutritional deficiencies, poor sleep, then again, it just builds, right? And becomes an issue for bone health, which is another big topic that comes up in menopause and postmenopause.
It's such an interesting thing, because it's such a wonky cycle. When we went through, in my case, you're in it, when I was having babies, that lack of sleep, as difficult as that is, it's that whole thing of having babies when you're younger, your body has this ability to recoup. Now, if it's just poor sleep, like we're waking up at 3 o'clock in the morning and are like, ring, zing, 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 for like 2 hours. And whether it's because you have to go to the bathroom and your bladder is doing what it's doing, or whatever's happening with our estrogen or progesterone, it's that lack of sleep that starts this. When we talk about a symphony of hormones, we have like a symphony of defunct that happens to have the energy to eat well. We eat lousy when we're tired. We're not as mentally prepped with the food prep that we have going on to get our off the couch and exercise, because we don't have that zip. And then inflammation in our body. And I'm probably missing a few pieces there in our choices. And so it's a very interesting thing. And then yet internally, the estrogen's affecting all those components within us.
Yes, exactly. And so this is where it can kind of, I think, for a lot of women, start to feel unmanageable, right? Because a lot of women don't really fully understand the changes that are happening, right? Obviously, they're living it, so they understand it in the physical. They know that their body has changed, and I think I may have said this last time, but like sometimes patients will come in and be like, I don't know, like I just all of a sudden my body feels different. My skin feels different. Like, and this is a real thing, right? Because your estrogen is low, so now your skin is not as lubricated. You're getting more wrinkles. You're all of a sudden noticing saggy skin. You're noticing, you even feel like your fat kind of composition feels different, right? And again, it's all like you said. And then if you're then also starting to have like what we call vasomotor symptoms, which are hot flashes and night sweats, then like you said, okay, now you're also not sleeping, which we know in of itself, even when we're younger and we have all our hormones in the right balance, that's gonna, fuel hunger cues and weight gain and all of the things. So it's sort of a perfect storm, right? And so again, I think um, figuring out how we can best sort of support um, all the hormonal balances, but today we're going to talk about estrogen is super important. But I do see too, like in terms of, I guess, the jobs that estrogen is doing. And then so generally when patients come in and they're in their 50s, or maybe they're not because maybe they went through menopause earlier, like just, menopausal women come in and it is going to be things like joint pain and inflammation happening. It's going to be the hot flashes and night sweats, which truly we don't fully understand the mechanism there, right? There's this dysregulated thermal cycle that happens. And most women will know that they have specific triggers like too much coffee or wine, like you said, or sugar, right? And that's likely because it impacts cortisol. But again, we don't always know the true mechanism there, which is really interesting considering it happens to, so many women. But we obviously know it has to do with the decline in our hormones once we're in menopause. So definitely like the vasomotor things, the skin, the bone loss, but also mental, emotional, right? So like if estrogen is sort of supporting serotonin and then it starts to decline, it's not to say that you don't have your serotonin. It's just that doesn't have that friend there, supporting it the same way. So that's where like sometimes women are going through depression, low mood, crying over everything, feeling ragey, like brain fog even, right? Not feeling clarity or just sort of feeling like I've had, conversations with women where they're like, I just honestly feel like the way I'm thinking is a bit different. Like I can't explain it any other way. And I'm like, yes, because our hormones have such a big impact on your mental, emotional health as well. And only we can kind of live and experience that, right? But it does have a physiological base in some ways as well.
Excuse me, Allie. I've got to say though, like, I mean, I'm like ticking off everything that you're saying. Yep, 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 yep. And there is this piece, I do not like to say it, but I'm going to say it because I find it hard to believe that I'm alone in this. But you have this level that you feel crazy. And you feel like I'm losing my mind. And why am I crying? Or why am I getting so angry over those shoes in the hallway that have been in the hallway for years that now all of a sudden they're just like, I'm throwing them out the door. I can't believe my behaviors. And but then even on top of that, you have like, okay, fine, just all you guys go. Just everybody just go. And this whole idea of going up to a cabin in the woods and just hanging out there and being a mad woman for a while is like heaven. Heaven. I recently spoke to somebody and she said she was envious of her girlfriend who had to go in the hospital for the weekend to have a minor surgery. And she was envious of her because she was going in the hospital and she was going to be taken care of. And that feeling kind of going back to, although women today are in a place where our mothers and grandmothers were not, I think some of us feel like we don't have that resource to even, as you're saying, with these examples of what exactly am I feeling right now and what is going on in my body. I think a lot of us don't have that resource, whether our mothers are not here or they don't remember or they simply don't want to talk about it. It's has this shameful piece to it. So would you be able to elaborate a little bit more on what is it that we're feeling? What is, I don't even want to say what's normal, but what's your list of things that women come in feeling that we haven't covered? Is there anything additional?
Yeah, it's a good question. I think, again, like you said, it's multifactorial. I definitely have heard this, like, I feel like I'm going crazy piece. And again, I think it is just because we end up getting this like decline of hormones, right? That we've had all of our lives. But I also think that there can be, and this isn't for every woman, um, but I think we do live in a culture of like, um, feeling like we have to do it all, which you touched
Mm,
on, right? So it's like, we work, we maybe manage the household. And I'm not saying that we don't have partners that are amazing and do things,
mhm,
I'm not
mhm,
saying that, but I do think
mhm,
that a lot of what I see is that a lot falls to us. So, um, not only now are you hitting a time in your life where the burnout is probably real, but now also on top of that, the hormones are starting to drop. So you're just like not as, I don't even want to say able to cope because that's not what it is. It's just that your reaction to those things is
you
going to
just
be different because you don't
mhm,
have this, you know, estrogen and progesterone to sort of buffer that cortisol, right? So it is almost this feeling of going crazy because, like you said, for 10 years, the shoes didn't bother you. But now all of a sudden, you're like, I cannot handle that. I'm going to cry or I'm going to yell or I'm going to, tell them that they need to go, you know, have a night out or whatever. Like it is. So I think that it's a combination of um, potentially just like overdoing. And again, I think that that is maybe for men too, but that's not what we're here to talk about, right? So it's sort of like just overdoing things. And then now you're also in a time of hormone decline. So you, and then the more you feel sort of out of control of your own like thoughts and reactions, the more that perpetuates this feeling of you're crazy, right? But I think that just understanding that, there is a hormonal component a lot of times to this is empowering in itself because you can be like, okay, this is what's going on for me. And, I need to sort of make some adjustments, and maybe that's lifestyle stuff too, or relationship stuff too, right? I think in a way, and you can correct me because, you're living it, but what I see, I think that menopause is actually really transformative in some ways because maybe it's like this different way of thinking forces us to recognize patterns that maybe were never serving us, right? The
mm,
things that we are allowing to happen in our lives, or maybe not even allowing, but just have manifested, or normals that we've sort of accepted, that really maybe never were serving us. But now we're like, okay, we can't deal with that now. So, like, in a way, it's like a transformation of sorts for some women once you kind of have the conversation or are able to sort of reframe things that way too.
yeah. Yeah, I think that's wonderful wisdom that you're having. Not only are you a brilliant woman, it's that approach and thought is really going to serve you well being in your late 30s. It really is. And we used to always say that 40 was the big turning point. However, after living 40s and through my 40s, I actually feel it's 50. Now, I may feel differently at 60, I don't know. But at 50, I felt I really started personally feeling a lot of physiological changes and a lot of mental changes. But I think, like anything, you kind of get pushed to an edge when we are doers, and particularly the roles that we do play as women. We do until that feeling of being burnt out, pushed right to the edge. And I often say we're at that cliff with our toes just curved around the edge of it. And I am finding that this period at 53, stepping into menopause, I'm sitting here going, okay, I'm being pushed with my body, my mind, my my spirit, my energy, and it is creating a clarity of what I want, who I am. I have hard yeses and I have hard no's, and I'm stepping away from pleasing. So I am not as worried about disappointing that child or disrupting. I know I said I'd do that yesterday, or we were going to do that, but I've changed my mind. And it's that path of what I call, am I betraying myself? I
Mm-hmm.
ask that question often. Am I betraying myself? And if I'm pausing and questioning that, I now pause. I now rest. So yeah, and that's the second spring. That's the
Mm-hmm.
beauty of this
Yeah.
really neat place that we're at. If we can get the information and get the tools in to support us. So speaking of that, Allie, let's dive into that. What
Mm-hmm.
can support us with this decline in estrogen? What can we do?
Yeah. So there's obviously it's, a big, broad kind of
Mhm,
area, but some kind of main, I guess, like lifestyle, dietary sort of tips and tricks. And again, as always, this is not medical advice, it's just informational. So if you're going to make any changes with diet, lifestyle, any of that, always kind of touching in base with your primary care provider. But these are just some kind of ideas that, have worked for my patients clinically and have some research behind them as well. So yeah, in terms of estrogen, one thing, and I think we had sort of touched on this with movement, is important is going more like low intensity and weight training is good, but not in like a hit style, um, because we do see that that can negatively impact estrogen levels. So you do want to lift weights because it's going to help with bone mass and muscle mass, which is going to help with healthy aging. But you don't want to be doing too much high intensity activity, particularly if you're going into menopause not in an ideal kind of physical state. So if you're someone who's already really fit going into menopause and you've been doing CrossFit for, 10 years and your body composition is already really healthy, that's a different story, right? But if you're hitting menopause and you're already maybe, a little bit overweight or feeling kind of comfortable, your muscle mass is not there, then starting into doing, the treadmill for an hour every day is probably not like the best place, right? It's sort of like get some steps in and lift some weights gently, low intensity, low impact. It's going to protect your hormones a little bit more. So that kind of piece in there. And caffeine is a big one. So reducing or eliminating caffeine, because we do know that too much caffeine can negatively impact estrogen levels already that are already declining. So generally I will have my, patients try and limit their caffeine. I think one kind of like cup a day is probably okay. But some patients find even one caffeinated beverage can trigger hot flashes. And so it really is dependent on the patient, but limiting caffeine is an important piece. So, if you're a 4 cup of coffee person, maybe want to look at reducing slowly. And again, um, just because that's going to support healthy estrogen levels. Um, Another thing that I like to sort of look at building is things like ground flax seeds. So they're actually really high in lignans that can help with healthy estrogen metabolism and healthy estrogen kind of regulation. So again, just something easy, right, that we can kind of throw into our day that's supportive. Also high in omega-3 and fiber. So, throwing it in a smoothie or putting it in, your yogurt or your oatmeal or whatever can be supportive as well. And it is something that I will often sort of talk about to my patients because it's super easy.
Is
Um,
that ground
yeah,
or full seeds? It
ground.
must be ground. We're talking about ground flax seeds. Okay.
Yes.
Yeah, great. And about
Yeah.
how much is a good serving per day? Like if we're throwing it in our yogurt or
Yeah, I usually
our
say like
shakes?
1 to 2 tablespoons. You know, if
Okay.
you're sensitive digestively, starting low and kind of working your way up is a good idea. Just because it is a source of fiber as well. But ground flax, yeah, because when you grind it up, exposes the lignans, which is what we actually want to sort of see.
Okay.
Um,
Are chia seeds a parallel to that, or are they sisters or friends?
Yeah, so I think like chia, hemp, like all of those are great sources of omegas. They're relatively high in protein, they're a good fiber source. But from a hormonal standpoint, the ground flax is the one you
Okay.
want to focus on when it comes to those lignans and the hormonal supports. So yeah, ground flax definitely. And then oftentimes I will talk to my patients about acupuncture, especially if they're having more of the vasomotor symptoms, which is the hot flashes, night sweats. You know, obviously, I will make sure lifestyle and the dietary pieces and supplements are all on board as well. But acupuncture actually has a lot of good research. So, you know, if you have an acupuncturist or a naturopath who does acupuncture in your area, it's definitely something to explore because I've had some really good success with that as well. Again, more from a symptom control for the vasomotor side of things. So
Wow, that's interesting. I didn't know that.
yes, so definitely a good option. Um, Also, this one is always tricky because I think sometimes the low libido and maybe like sometimes there's vaginal dryness and things like that, but actually like more orgasms is good for your estrogen. So, you know, whether that is right, like, you know, so, and again, it's going to help kind of with um, more lubrication and things like that. So I think kind of working on that, whatever that looks like. And sometimes that looks like talking about the fact that the longer you're in menopause, the more likely you are to have some vaginal dryness and maybe atrophy, which is where the tissue starts to thin. Because estrogen, we said, is a lubricator and a builder, right? So it keeps the vaginal tissue really healthy. So if that is a bit of a barrier when it comes to having orgasms, whether it's with a partner or on your own, then that's something that you would want to work with sort of a qualified professional to kind of address, right? Because there's lots of options there, whether it's doing BHRT, which is bioidentical hormone replacement, or sometimes the OBGYNs will give things like Vagifem, which is a vaginal estradiol. There's lots of options. There's non-hormonal options as well. There's herbal and hyaluronic acids that you can do topically. So I think it's just sort of knowing that keeping a healthy sexual activity, it's going to help your hormones, but also really kind of being okay with having that conversation. And if you don't have a practitioner that you feel comfortable having that conversation with, then, you know, maybe looking for one that you may feel more comfortable around that.
Yeah.
Because again, I think it is a big issue that I see, and maybe one that's maybe not as sort of vocalized.
Oh, yeah. And
No.
if you have a physician who you have difficulty or even is doing the response like you just need to tough it through, that's a tough conversation to have.
Yeah.
But this is something that somebody like yourself, we can step into the possibilities here for support if we don't have an OBGYN.
Yes, exactly. So, um, naturopaths in Ontario, if they've met the prescribing standard of practice, they can prescribe bioidentical hormones. So, you know, sometimes we can do things like vaginal estrogen. Again, only if it's indicated. Oftentimes, I honestly truly find that optimizing hormones, you know, in general, systemically, and then doing herbal supports as well is enough for a lot of women. So I think sometimes when it comes to hormones, you know, if patients are a little bit more hesitant, it doesn't have to be that, right? But there are options for sure in terms of vaginal topical applications as well. And then I know we had kind of talked a little bit about, you know, estrogen replacement, which again, naturopaths in Ontario, we do have access to topical bioidentical hormones. So I'll usually use something like a biased, but again, it's very dependent on your risk factors, because obviously with any hormone replacement, there's going to be that conversation, right? So you have to be the right candidate, be comfortable with all of your options, but it is definitely an option. As a side note, if you still have a uterus, you do have to use progesterone in addition to estrogen. So I think, I know we had chatted about doing like a whole kind of talk about bioidenticals. So I think that's a really big topic that we can kind of get into. But definitely estrogen replacement is a possibility for women, really effective at managing like the vasomotor symptoms, so the hot flashes and night sweats, oftentimes really helpful in that vaginal atrophy side. And for some of my patients has been game changing for mood as well. So, and I think obviously thinking about all of the other pieces, right? Bone health, cardiovascular health. So there is some benefit there as well. So that's another option when it comes to, what can we do about our hormones? But it isn't always just about kind of putting the hormones back in place, right? I think a lot of the other lifestyle dietary supports are important as well.
Yeah. And I think that would be a wonderful conversation for us to step forward into at a later date, because HRTs, hormone replacement therapy, it is frankly such a hot topic right now. And the whole history of it, and basically what our mothers went through. And so we definitely will. We will address that further. You were mentioning herbal. Is there anything herbal suggestions or supplements that, besides the omegas? I'm trying to think.
Yeah, so I will often use like herbal blends. Again, depending on the main complaint too, right? So not every woman who comes in kind of in menopause is complaining of hot flashes. Maybe it is more the mood, maybe it's just more, body composition. So it's a little bit dependent there, but there is a variety of herbs that can be used to sort of support just general hormonal well-being. So some of the big ones for estrogen would be like black cohosh, dong quai, which is also known as angelica. Sage can be really helpful for hot flashes as well. So those are some of the big ones. Maca root can also be supportive. Which I have definitely seen clinically. And actually, there is a product, and it's made from rhubarb of all things, but that can be really helpful for hot flashes as well. So just there's a big spectrum of natural supports. Again, really dependent on like the patient, their health history, any kind of other, conditions that they might have or medications. So again, I always say to people when we have these conversations, because it's natural doesn't mean it's safe. So always making sure that you kind of have a conversation with someone who knows your health history of what might be best in terms of management. But there's a lot of herbal options. Also, I know I always like bring up my favorite mineral, but magnesium is amazing. So that in itself can be helpful with sort of like the sleep disruptions and the hot flashes, night sweats. And again, the mechanism there is probably multifactorial, right? So, but it is a really great option. And I probably do recommend it to a lot of my patients for hormonal well-being. Again, just as an overall support.
So when we're talking about supplements, though, there is, as you had said, there is a safety factor here. Just because they're natural does not mean that is necessarily for your body, or even how much you should be taking. And again, kind of stepping back a bit, in our last chat, you talked about the hormonal symphony. And even though we might have one symptom over here, it is about how it looks in the full big picture. So it's just so important, because we can go on the computer and we can Dr. Google anything, but this is serious stuff. And to really take the time and have somebody on your team, and that's your own personal team, to support you through this, I just feel is so important. Valuing ourselves and putting the time, and if it is money, if insurance isn't covering it, to put that into yourself. so you can feel healthier, feel stronger, feel, that you're embracing life versus the depression and the sadness and the rage.
Yeah, exactly. And I think that's a really good point in that, you know, again, this whole idea for, I think, some people where it's like, well, menopause is about estrogen, so let's find something that's going to support the
Yeah.
estrogen. But we know there's so many other pieces, like you said. So, you don't want to imbalance things because then you might not get results or you may not be feeling well. So yeah, definitely having someone on your team that can kind of step back a little bit and be like, okay, but we need to look at X, Y, Z as
Hmm.
well. And then also, um, was I gonna say something else that you had mentioned struck me, but I lost it.
It's okay. Welcome to my world, Allie. Just welcome to my world. Before we I had some thoughts on some additional lifestyle habits that I've worked on for myself that I'd like to share with the women listening. But before we do that, can you speak to Alzheimer's? And I know that there's a lot of different concerns that we have about, and we can get into this further maybe when we talk about HRTs and, bone density cancers. But is there, it just, Alzheimer's, can you talk to that as to what's happening in our body and are there facts out there? Is there a strong correlation to our loss in estrogen, to what's that? You see, we go through that brain fog and you get
Mm,
scared. As
yeah.
I get scared, I'm kind of like, oh my gosh, I can't remember yesterday. I can't remember where I put my glasses, where my phone is. And so that brain fog puts you in this state, like kind of like how I initially was talking. You can just go into, then you get into this anxiety thing, and then you get into like the heart palpitations, and then you're like, oh my gosh, what is happening? And is there not? Yes, no?
Yeah, that's a good question. And I don't know if I have the best like evidence-based answer off the top of my head. But what I would say is you're right, estrogen supports our brain health and our brain tissue. So definitely, although I don't think just because we're going through menopause and we're low in estrogen, it's going to mean we're going to have Alzheimer's, right?
Yeah.
But yes, estrogen does protect our brain and it kind of supports brain health. I think some of the bigger sort of markers for me would be really focusing in on healthy blood sugar control and some of the other factors because we do know there's some evidence to support the idea that things like Alzheimer's and the buildup of the plaques in the brain can also be related to blood sugar imbalances and things like that. So for me, and again, I listened to a really interesting conversation a while back about memory and Alzheimer's and cognitive decline. And, a lot of the things were like the basics, right? Eating really well, protecting your blood sugar. Also, like continuing to use your brain is really, really
Mm,
important. And so
mm,
sometimes what I see happen is, someone is menopausal and they're retiring and their kids are leaving. And so now they aren't doing a lot. So the job that they were doing and using their brain every day, they're no longer doing. Their kids have gone away and they're trying to, re-get to know their partner maybe, right? Which might be going well or not. And so sometimes it's like this inactivity, and then that is not good for our brain. We need to continue to challenge. And so sometimes, if I have this person in front of me, I'll be like, you know what? It doesn't have to be big, but like choose a skill and try to work on it. Maybe
mm,
you want to learn to play the piano. Maybe you're going to take up cooking. Maybe you're going to do sourdough. Maybe like you have to, and I know that's not really answering your question when it comes to the estrogen piece. I think there's more to it than just the hormones, though, I guess is what I'm
mhm,
saying, right?
mhm,
Because we've been going through menopause for hundreds of years, and so I think that there's definitely more to it than just the estrogen. Is supporting, our overall hormonal health into menopause important? Absolutely. The more we can support that balance, I think the better off all of our systems are going to be. And we do know estrogen plays a role in the brain. How it, ties directly into things like Alzheimer's and plaques, I'm not 100% there, but with things like cognitive decline, then yeah, you would think about just overall hormonal balance, managing stress, continuing to use your brain, right, eating well, and all of those pieces, um, kind of coming together to support our best cognitive health as we age.
Yeah, thank you. Thank you. And maybe that will lead us to another conversation when we talk about different illnesses, perhaps, or connections to that we can look at futuristically. It's interesting when you were talking about walking, though. I recently was reading somewhere how important it is actually to go for a walk and talk, walk
Mm.
and talk, and geez, if that's all we have to do, ladies, then that's we can just go take on the waterfront trail and get that
Yes,
done.
and chat.
Yeah, exactly. And we would
Yeah.
have this double combination because we will be recognizing our energies within each other. We'll be supporting each other. We won't be feeling alone, and we'll be connecting and letting it out versus letting
Yeah.
it out on each other versus the poor innocent bystanders here in the house. It's just those poor people, those poor humans that came out of me. Ellie, is there anything else you'd like to speak to
Oh,
that we might miss?
I think that we've covered a lot. I definitely feel like, yeah, we can chat a little bit more about sort of hormone replacement, and I will kind of look into the cognitive decline piece a little bit more.
Yeah,
I just don't want to comment with anything that's inaccurate.
perfect. No, that's what I would ask of you always. Well, I wanted to share with all of you as well, like being in this space and kind of talking about a few different things. My body has, as Dr. Ali knows, has acquired a lot of inflammation, and I was diagnosed with fibromyalgia some time ago. And as I've gone through many bits of work and fitness and lifestyle, it's always in the back of my mind if it's not in the front. And I really and it will scream at me if I don't take care of my body and if I kind of go a little sideways. And so it's been a neat kind of thing, just as Dr. Ali was discussing earlier, that this period in our lives between 40 and 60 where this transformation happens, it's like we're getting pushed into a corner with some spikes and we're being pushed to make change. And so that's been something that has pushed me to really try my best to stay consistent with foods and drinks going in my body. And now I'm extremely human. And so I've had periods that I have not, but then I have to reroute. And so as a result of that, I came up with just 5 kind of points that I thought I could offer you at this point for myself. And maybe there's a tidbit in there that you can take and shift and perhaps take a little bit more control over this thing that's taking over our body, like having a baby, and take a little bit of control over it and maybe see what we can change because we do have this possibility at this moment in our life. And the first one I had was discipline. And is talking about, or I'm actually talking about, discipline is important. It's listening to your body with discipline. So, such as that fatigue, when that fatigue is coming on, it's okay to rest.
Mhm.
Even though you've made a commitment somewhere, even though you know you should do something, or you think you are going to disappoint somebody by not doing it, but your body is just like I explained it last week as I am just tired to the bone. That was the best way I could explain it. And it didn't make sense. I hadn't done anything overexerting, but I was just so darn tired. And so it's important for us to just really honor that and discipline ourselves. But it also means to me is to take those steps, to get outside and walk. Even though I'm tired, you don't have to go walk 42 kilometers, but you can walk just even around the block. Get yourself outside. That walk, that movement, that strain on your body to move is very building and very important. Number two, I have, as much as wine is lovely, and I do love wine, and I learned to love wine in my 40s. In my 50s, wine has not become my friend. I have had to incorporate my number one of discipline and add it to my love of wine and my love of enjoying the moment of holding that goblet with the wine. So now I have to reel it in because wine affects my sleep, because wine affects my energy. It affects my brain is foggy. It affects how I approach the next day. And I'm not quite sure, but sometimes there's a connection to my digestive and my joints. I'll leave that with you.
Yeah.
But looking at our habits that we've always had, it's okay. We're allowed to change. This is a time of transformation. Just because we used to do it doesn't necessarily mean it's something for us today. Number three is strength training. Strength training, having the whole fitness and personal training world for the past 30 years, I do respect the importance of it. However, I too have changed my fitness routine. I give myself 2 days off between each strength body part. I break it up pretty much into an upper body workout and a lower body workout. And I always do whatever I mentally can do. Sometimes it's only 4 exercises and I only do 8 repetitions and I might only do 2 sets. Other times I might do a bit more. It's psychological for me to do it because then I eat better, I sleep better, I'm making better choices throughout. And what we're also understanding is this sugar balance within our body, recognizing it and owning it to whatever capacity that is. And it's affecting our inflammation. Number four is rest. I have it written down over here. And the interesting thing is it's deep rest. Deep rest is not just, oh, I need a good night's sleep. Deep rest is about really honoring who and where you're at. It means you're having some time, big chunks of time of sitting and resting, even though you feel like you shouldn't be. You should be okay. I should have the energy. It's about being kind with yourself and really, really listening to your body. If it's tired, let it heal itself, let it rest. But also understanding it can be that slippery slope into sadness, possible depression. So knowing when and what that looks like and being very compassionate with yourself in that process, not being super, super hard. This is not the time to be super hard on ourselves. This is the time to look, discover, be curious, make some changes, and be okay with, as I was saying earlier, with those hard yeses and those hard nos, and everybody else will have to figure it out along the way. And the last bit is I'm practicing to soothe myself. So, whatever that might look like. So, in the morning, I get up, I sit on the couch, and I pet my dog. And then I get my cup of coffee. And then I maybe this time of day, I go just outside. I take in the air. Sometimes I set the alarm, but it's getting outside. It's doing what I need to do to soothe myself. It might be listening to music by myself. A lot of it is by myself. It's about getting outside, touching your bare feet on the ground, getting your hands dirty in the dirt. And just finding ways. Meditation, of course, is a huge piece for me that I find because my nervous system is a little peculiar in the past 4 or 5 years. My palpitations get going and I'm not really quite sure what's happening. So I have to really practice soothing myself and easing myself. And meditation works. And there's a lot of different avenues to go, which I know that you guys have those. So those are my little tips that I hope that maybe there might be a little piece in there for you. And I hope that you've received some bits of information from Dr. Ali. Thank you Dr. Ellie, as always, for your kindness, your compassion, and of course your plethora of knowledge and inspiration for us as we go through this period of change.
Yes, amazing.
Thank you. We'll see you again.
Sounds good.